Okay, difference between coagulative necrosis and liquefactive necrosis. In coagulative necrosis, mechanism is like just denaturation of the protein, but in liquefactive necrosis, it is enzymatic digestion. In coagulative necrosis, uh, the cellular outline is preserved and the liquefactive necrosis cellular outline is destroyed, completely obliterated. Coagulative necrosis, it is fixation of the involved tissue is fixed and firm, but in coagulative necrosis there is no fixation. Cyst formation, pus formation happens in liquefactive, not in coagulative. And coagulative necrosis happens anywhere in the body, hypoxic death of the solid organ except brain. But liquefactive necrosis happens in abscess containing area, abscess and hypoxic death of brain. Okay, well, another thing like liquefactive necrosis, uh, the etiology is gangrene, and there may be CNS infarct, and the morphology is necrotic tissue is digested by the hydrolyzed enzyme into a viscous fluid. Like infected abscess, fluid is creamy yellow due to dead leukocyte. Infected abscess is fluid is creamy yellow due to dead necrosis like pus formation, and brain infarct resolve into CSF filled spaces. And coagulative necrosis, irreversible ischemic injury outside the CNS. In here, tissue architecture is preserved due to denatured lytic enzyme, and the cells are anucleated with eosinophilic cytoplasm. There is leukocytes eventually infiltrate to and digest the necrotic tissue. Other necrosis like caseous necrosis happens in microbacterial infection, like happens in fungal infection like histoplasmosis, cryptococcosis, and coccidiosis. In here there is friable cheese-like material composed of cell membrane and amorphous proteinous debris. It is surrounded by the epithelioid macrophage and giant cell like granuloma. And the other is fat necrosis, happens in acute pancreatitis and trauma, subcutaneous adipose tissue. In here, free fatty acid released by the active enzyme lipases or mechanical damages. There is chalky white deposits, saponification. And another is fibrinoid necrosis, happens in hypertension and vasculitis. In here, there is damaged vessels, leak, fibrin and immune complex and eosinophilic layer of the proteinous metal in vessel wall. And that is the pathology of the tissue necrosis all. Hope you enjoy.